The president's answer to the Delta variant is the vaccine. Meanwhile, the CDC warns that Delta will become the dominant COVID strain here in the United States. Dr. Ebony Jade Hilton joins me now. She's the co-founder and medical director of Goodstock Consulting and an associate professor of anesthesiology and critical care medicine at the University of Virginia. Dr. Hilton, great to have you back on. As we've been reporting, President Biden marked a new milestone on Friday, 300 million coronavirus shots administered during his first 150 days in office. He says that we are heading into a, quote, very different summer than last year's. In what ways will this summer be different, and in what ways might it remain the same?
Right. Well, for one, I think it'll be different because now people truly are COVID fatigued, but it will be the same in that we are not done with this pandemic. We truly do have potential to have what I call a pandemic within a pandemic, where these variants, because of the way that is more highly transmissible, that it literally evades our immune system, even for those who are vaccinated fully, we're seeing that they can still become infected with COVID-19 and actually pass away from COVID-19 with this Delta variant. It is something that we cannot lessen our guard, and we have to remain hyper vigilant in protecting ourselves so we can see 2022.
Well, we know that there has been a geographic gap in the vaccination effort, with southern states in many cases being less likely to be vaccinated. And then the president also stressed the importance of bridging the racial gap in vaccination rates in order to save more lives. Talk to us about how these gaps are impacting vaccination efforts and what are the keys to actually closing it.
Right. I think we have a couple different buckets we have to consider. We have the vaccine hesitant. Those persons have been, thinking that the COVID-19 pandemic has been a hoax from the very beginning. We have the vaccine curious people who literally just want to see what is the data showing me before they make these decisions. And then we have the vaccine denied people, and those persons, those that are in those vulnerable populations, those targeted populations where there is lack of access, where there is a limited ability for them to get to a vaccination site. How do we make this more equitable in our approach? When we say, even with our mobile clinics, that we're going to allow this from 9 to 5, if I'm working 2 or 3 jobs trying to provide food for my table, I don't have a 9 to 5 schedule that I can come and meet you for that vaccine. So how do we get creative in that approach? But honestly, at this stage, what I urge everyone, you can literally text your zip code to get vax, which is GETVAX. Text your zip code to get vax, and you can find exactly what centers are available to you. And let's try to meet in the middle. Talk about what your questions are so we can keep you and your family safe.
I always appreciate how you sensitively talk about that subject. I want to shift gears a little bit and talk about the global fight, because we have watched as COVID has traversed the planet, and now the World Health Organization is warning that urgent action is needed in Africa. Cases there are surging in nearly 24 nations. What kind of action is needed to avoid overwhelming the continent's health system?
Right. I think it's not only to avoid overwhelming the continent's health system, but our entire global health system. What COVID-19 has shown us is that as separate as we are and separated by these ponds of water, right, that we truly are one people, that what happens in India, what happens in South Africa, what happens in the UK, happens right here in our own country, too. So we have to be hyper aware of what struggles they're facing. And the struggles that Africa is facing right now, the continent, is that they've had a 44% increase in their COVID infections. They've seen a 20% increase in their deaths, and we know those are grossly underestimated. At the same time, they have less than 2%, 2 to 3% of the total vaccines being afforded to that continent, because we see where wealth is again showing its face in the realms of public health measures that shouldn't be there. And what do I mean by that? For the wealthiest countries, for every 100 persons, that we have at least 60 doses of vaccines that's been administered. Well, for the poorest countries, for every 100 persons, that number is one dose of COVID-19 vaccine that's been administered. And if a variant is allowed to present itself, it will go from South Africa, from the sub-Saharan Africa, and it will meet you right in your zip code, in the wealthiest zip code in the United States of America. We all have to be concerned when one is concerned.
And in fact, the chief scientist of the World Health Organization is warning that the Delta variant is, quote, well on its way to becoming the dominant strain globally. How devastating could this be?
Oh, it's extremely devastating. What we have to remember in the United States is we did a really good job of vaccinating our elderly population, right? We over 70, 80% of our elders are now vaccinated, which means that the persons that's in our hospitals, the people that I see in my ICU literally are 20 to 50 years old that are in the quote unquote, they haven't died from COVID-19, but I would urge persons to think there are some things that are worse than death. And one is when you're struggling to breathe every single day. And that's the reality of what some persons are feeling, although they are recovered. And so when we're thinking about those groups of persons in that middle range of life who are saying, I don't know if I want to get vaccinated, understand this, that there's collateral damage that's outside of the realms of death. And that includes not being able to breathe. If you do die, unfortunately, we're seeing 40,000 new orphans left in the United States alone. We know that there's these long hauler symptoms of where people are saying, I can't think clearly, I'm having heart failure-like symptoms. And what does that do to your longevity of life when you're experiencing that when you're 30 and 40 years old? We can't afford to take that risk, especially when we have a vaccine that has proven itself to be safe and effective.
Dr. Ebony Jade Hilton, thank you.
Mm-hmm.